What we're going to do now is we're going to take a look at how to layer techniques, instrument assisted, using the Hawk grips in the Hawk grips cupping systems. So we're going to take a look at using cupping to increase some blood flow to those particular areas, maybe relax some soft tissue, help to mobilize some soft tissue. If it needs to be stabilized, then we're going to do stability exercises, but we're just going to mobilize the soft tissue now using the Hawk grips instrument assisted techniques. So we're going to apply a little emollient. Maybe we'll use the Hydro in this area. And so what we're going to do is two cupping techniques. One is going to be a static cup on a static body part, and one is going to be a dynamic cup on a static body part. So as we get into our technique first, we'll work that infraspinatus. We're going to do the posterior cuff, posterior deltoid, medial deltoid down to the deltoid tuberosity. Maybe work that quadrangular space, do a little fanning with the scanner in this particular area here, and it works very nice and fits that concavity with a convex tool. One thing to always take a look at too is maybe we can go ahead and use the tongue depressor and do a little J stroking up and down the medial border of the scapula, working around that area. And so now I'll go to my inferior angle. After I've gone ahead and I've done some instrument assisted assessing what needs to be, or mobilize what needs to be mobilized. So I'll go ahead and do that, and I'm going to add another layer to this. I'm going to take our cups. What I'm going to do is I'm going to place them in the particular areas I'm looking for. One nice area is to work over this quadrangular space. Maybe we'll want to run a cup or two over the supraspinatus and really work this broad muscle belly, the infraspinatus right here. So I'm going to apply one cup. Maybe what we can do also is work inferiorly along the infraspinatus here. And so what I'm going to do now, I'll take this off for demonstration. I'm going to begin to start to move this cup with the emollient in that particular area. I may want to do various patterns back and forth. I've got some tension on that, negative pressure into that cup right now, distracting that skin, compressing through the rim of the cup and decompressing with the negative pressure in the cup itself. I might want to move around to the inferior angle of the scapula and run right up the medial border and into the rhomboids. And then if I want to, I could take that cup still with a negative pressure in up above the supraspinatus and even up into the cervical musculature and through here. I'll work that around here. And then maybe I could go back to some static cupping again. Take several cups, lay them in strategic places along those muscle bellies. 3 to 5 minutes, whatever you feel is appropriate at that point. I'm able to assess the integument because I can see through the cup. And then what I'll do is once I pull these off, release the pressure and assess that integument and then remeasure again to see if we've either increased range of motion or decrease in pain.